A good number of the 2.7 million elderly citizens in Kenya struggle to access even the most basic healthcare services due to the lack of resources to cater for the cost of treatment. Now, the situation is worse in rural areas where medical facilities are located quite a distance from the majority of the elderly people, many of whom can hardly walk for long distances or even afford transportation costs to access the healthcare services. Well, this year's International Day of Older Persons celebrations held in Laikipia this week helped to expose the magnitude of the health crisis after close to 1,000 elderly persons scrambled to be attended to at the free medical camp in rural Laikipia County. Martin Munene witnessed firsthand the dire situation of elderly people in Segera village in Laikipia County and brings us the story.
As the country marked the International Day of Older Persons at the Segera Mission in Laikipia County, long queues characterized the outside of Segera Mission Hospital, where a team of volunteer medics and a charity organization, Sakun, had pitched a tent to provide free medical care to the elderly here. A scene that is all too familiar in a country where close to 3 million Kenyans are elderly persons, according to the 2019 census. The situation at Segera painting a grim picture of the health situation in the aged population in Kenya. Some even defying their age and health constraints, opting to stand in line to wait for their chance to see a medic, despite there being a tent in which they could wait. Simon Tunei was lucky as he was among the first to get here, where he had brought his 80-year-old mother, Koinet Tunei, to get a medical checkup. He says her health has seen better days, and he points a finger at the environment in which the mother and other elderly persons in the area live in.
Mama, kitu ya kwanza ile maji tunatumia ni chafu. Ndio tunaona hiyo kitu ndio nasumbua sana watu wetu, sana wasee kama hawa. So na maji ni mbali, ndio ataenda kuenda kushoto kwa mto. Ndio naona kama hiyo shida ya kwanza ya afya sana na kutumiwa maji chafu.
Simon's greatest challenge is the fact that life has not been easy lately, as the drought in the country in the recent past has robbed them of their main source of livelihood, making it hard for them to address their aging mother's health needs.
Afya yake tunaona vile tu hiyo tujilali tunaangamiza sana wasasi kama hawa. Juu ng'ombe imeisha, mbuzi imeisha, na hiyo ndio tegemeo letu sana kama sisi wakulima wa mfuko.
Their situation is similar to that of many elderly persons here. A few lucky ones have been forced to depend on the 2,000 shillings monthly stipend from the government that unfortunately is not sufficient to meet their basic and health needs.
Sasa Mungu ananiwezesha nifike hapa. Kuna mwingine hataweza. Na kuna uchungu na nasikia kuna dawa ya bure inapeanwa hapa kwa hospitali na viki. Ana pesa ya kuja, kutoka pale kuja hapa ni pesa na kurudi ni pesa.
Tunajaa sana. Kwa hivyo watu wale wakogwe hataki furaha, hana furaha kwa sababu anajaa. Wanakuwa mashida ya mwili, mgogo, wanakuwa na tabu ya chakula kwa sababu ya hata miguu na hata matatizo kwa sababu ya njaa.
For them, this camp could not have come at a better time. And according to the medical experts here, some of the medical conditions among the elderly are preventable and treatable if the living standards of the elderly could be improved.
Here is mainly malnutrition, mainly elder disease, then gout, there's a lot of joint pain, a lot of things, and a couple of cases we get the hernia also.
Eye surgeries, we have dental surgeries, we have tumors. It's interesting, there are lots of people here with tumors that we don't realize, so we're trying to treat those as well.
The medical camp took place on the sidelines of the national celebrations to mark the International Day of Older Persons. The State Department of Social Protection Principal Secretary Joseph Motari called on Kenyans to take better care of their aging kin, as opposed to letting the cash-strained government bear the bulk of the weight of taking care of the elderly.
This older person needs care and love at that age. So I want to ask also all Kenyans that please let us take care of our old people.
We need to understand that they are a very integral part of our system in the home. And once that is all taken care of, then a large part of our problems will be taken care of.
A reason these elderly persons want the government to do more, and by more, they mean ease of access to medical attention in terms of cost and distance.
Tunaomba serikali tupatie kadi ya NHIF ili tuone dawa kwa hospitali.
Ajitolee tu kwa upendo, aone sisi ni wamama, miaka yetu ni mingi, na sasa hii miaka imefika, hata dasa kosa namna ya kujisaidia.
PS Motari is saying the government is committed to taking care of the elderly and the concerns are being addressed.
A lot of the elderly are not able to access healthcare in the country due to cost implications, and they're now calling on government to provide them with insurance to guarantee their access to healthcare. Martin Munene, Citizen TV, Segera, Laikipia County.